Okay, in this spirit of reconciliation, we'd like to acknowledge that we're here on Wurundjeri country of the Wurundjeri people of the Kulin Nation and pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people today. So on the couch with me today, we're actually going to be talking about specialist services. So specialist services is one of the high demand areas for us here at DHSV, and it's also one of the most expensive for us to deliver. So I want to talk today about how we're actually making sure that access to specialist services is equitable for people, but also how we're actually implementing the principles of value-based healthcare into that service. So today on the couch with me, I've got Priyanka Bhatt, who's here as the Manager of Specialist Services in RDHM. So welcome, Pri.
Thank you, sir. Appreciate the opportunity of being here and having a nice coffee conversation.
A nice coffee, and we actually do even really have real coffee.
We
so
have
that's
real
pretty
coffee.
exciting. So I'm going to ask you the first question. So value-based healthcare is about providing the most appropriate services to our community and how we improve health outcomes for that community. So how does that actually work in specialist care? What does that look like for us?
I think by constantly striving to improve the quality and, the measured outcomes in terms of what the patients really want, understanding that and, trying to deliver services that are more efficient, but also center the patient's need primarily. I think trying to fit all of that in and trying to keep the patient in the center of all your, healthcare delivery process. So, yeah.
I think that's, one of the key principles of working in healthcare is how do we keep the patient at the centre of all that we do. So it's great to hear that that's what specialists are doing. Given the huge demand, how do we actually make sure that we're providing services and access to those most vulnerable in our community? What does that look like for us?
I think from a Dental Health Services Victoria perspective, the idea of having priority groups and the idea of having an eligibility criteria, given the fact that we're the only public dental hospital that's got access to specialist services, it's huge. I think it's definitely huge. But understanding that we have got a very vulnerable population that is possibly at a very high risk, and we are the only center of care, we've got to look at things such as what is the quality of care? And I think even somehow by definition, the quality of care does look at things such as social inclusion. So I think having those principles amalgamated in what we do absolutely has been, I think it's been amazing. It's been amazing.
Excellent. Yeah. Can you talk me through the benefits of the new system that we're trying to implement?
I think I do want to acknowledge Wayne Chow for his fantastic work and all the heads of units, because for the first time, we all got together in a room and we thought, how are we going to put this all together? Everyone's got a different perspective. But towards the end of it, the simple question probably was, what do you see in terms of improved outcomes for your patient? And we thought, if we refine this process, if we streamline this process, we're making it so much easier for the community dental clinics to understand what are we really accepting? What can we see? What is our capacity? Or, what are we efficient at? What are we delivering? I think clearing those things makes it a bit more transparent. And it's like having a nice tool to empower the community dental clinics to take that decision with the patient of referring the patient to the hospital. So I think throughout the patient journey, from a community dental clinic to Royal Dental Hospital Specialist Services, ensuring that it's more fair and the patient understands what they're getting themselves into as well. Yeah. So I think the whole referral process would help us keep that very transparent.
I think you're right. I think the community agencies and being able to get that visibility for them about how the patients are being processed through the system, I think is really important, because that's the feedback we get from them is we don't know, we send off a referral and something happens and we don't know what that is. So I think it's a fantastic piece of work, and I agree. Congratulations for Wayne for getting everybody in the room and having the conversation. So from a specialist care perspective, what do you think we need to do differently to have a bigger impact on our community?
I think that's a very interesting question, but I think we haven't really been partnering a lot with community dental clinics. I think there's a sense of divide that comes somehow, because it's like, we've got some 53 community dental clinics, and it ranges from a community dental clinic like Orbost that might have one chair or two chairs to Monash Health or Peninsula that's got like 30 chairs, how do we try and integrate and develop, partnerships and try and make this journey smoother for the patients, and also looking at empowering the general dentists, because let's be honest, if we look at specialist care workforce, we've got very limited number of practitioners. Yes, we've got, new postgrads that graduate each year. What can we do differently to ensure that they don't get lost in the system? And, as much as I would love for them to be able to have their private practices, how do we, integrate them into the public dental system to see if they could somehow love the feeling of giving back to the community? And I think that's where, some work still needs to be done. How can we partner better with Melbourne University to look at, all these future specialist clinicians that are going out there? What can we do in that aspect? I think that's definitely something to think about.
I think it's about developing that value proposition. So what's DHSV or the public dental system's value for a private practitioner or a specialist? How do we actually keep them engaged in the system and supporting that public practice, which I think is a lot of work that we need to do around how we actually keep people in our public dental system.
Absolutely.
All right, I have one last question for you. What does the next 12 months look like for you and your team, and what are you most excited about?
Oh, there's heaps. I don't know where to start from, but I think electronic oral health records being the first of the list, I think I'm too excited to, be a part of the project control group and be able to see all the clinicians on the panel as well, and, see people brainstorming how we can make it a bit easy, fair, transparent for everyone across Victoria. And even in terms of like the medical records, I think, for dental to hop onto the same bandwagon, I think it's really exciting. We've just got an approval for 3 million funding for dental assistant traineeship, and I am so stoked about it. You'll probably see it on my face, but I think workforce shortages are one of the biggest barriers to healthcare access. And I think, no matter what the quality of the treatment is, but if we have got workforce shortages, it just means longer wait times. So the fact that we've got some funding, the fact that we can have some, fresh trainees being trained at Dental Health Services Victoria and, be a part of primary care, general care and specialist care, I think I'm very, very excited for that. Also looking at tidying up the final stages of the referral criteria, so getting that out and establishing this new e-tray process to make sure that the whole referral process from the community dental clinic to Dental Health Services Victoria is a bit more smoother. I think they are definitely some of the key things I'm looking forward to. And one more is probably from an RDHM perspective is our CSSD. Have to give it to them. It's a very hardworking team, and I think I'm quite excited to see what improvements we can bring in that area to get that game up too.
Excellent. Yeah. Thank you for spending time on the couch, and we look forward to what Specialist Services is going to deliver over the next 12 months, because I agree, really exciting times.
Thanks for having me again.
Thanks, Bree.